Hello, thank you for joining us for Unite for Sight's webinar about paths to a fulfilling career in global health. We're thrilled to have all of you with us here today. My name is Jennifer Staple-Clark, and I'm founder and Chief Executive Officer of Unite for Sight. I will briefly introduce you to Unite for Sight, review the webinar logistics, and then we'll hear from our 4 expert panelists. Unite for Sight is a global health nonprofit organization that promotes high-quality care for all. We offer extensive global health and social entrepreneurship education programs. Our Global Health University program offers a free webinar series, including today's webinar, and we also offer 20 online certificate programs for students and professionals. Many students receive academic credit for these certificate programs, and many professionals pursue the certificates for professional development purposes. The certificate topics range from a certificate in global health and a certificate in global health research to a certificate in cultural competency, as well as 17 other certificate programs as well. Additional educational opportunities for students and professionals includes participation in Unite for Sight's annual global health and social entrepreneurship events, which focus on responsible global engagement. Our 14th annual Global Health and Innovation Conference, which is the world's largest Global Health and Social Entrepreneurship Conference, will be on April 22nd and 23rd, 2017 at Yale University. The conference includes 300 speakers and more than 2,000 participants for a weekend exchange of ideas across all disciplines of global health, international development, and social entrepreneurship. The conference website and registration can be seen at uniteforsight.org/conference, and we continue receiving abstracts for certain categories for presentation at the conference as well. In addition to the Global Health and Innovation Conference, we also have an upcoming social entrepreneurship event. It's called the Social Entrepreneurship Institute at Yale University in just over a month on December 2nd, 2016. And all the details about that additional event is at uniteforsight.org/institute. And we will be thrilled to have many of you attending one or both of these events and encourage you to find the details on our website. In addition to these educational opportunities, we also have healthcare delivery programs, which provide care to patients living in extreme poverty. We partner with phenomenal local eye clinics in Ghana, Honduras, and India to provide quality eye care to patients who are otherwise unable to access or afford care. These programs are locally led and managed by the local medical professionals, and our collaboration has provided eye care to more than 2 million people by local doctors during the past decade, including more than 95,000 sight-restoring surgeries by the local ophthalmologist. Unite for Sight is the world's only organization that is both a healthcare delivery organization that also offers immersive global health education and social entrepreneurship opportunities for students and professionals. Participants have the opportunity to support and learn from local doctors in Ghana, Honduras, and India as they provide care to patients living in poverty in villages, slums, and refugee camps. And the participants support and learn from those medical professionals about patient barriers to care and about effective strategies to reach the hardest to reach patients who are otherwise unable to access or afford care. And the local doctors are incredible social entrepreneurs who design effective and innovative strategies to eliminate patient barriers to care. Now that I've described a bit about Unite for Sight, I will describe the logistics of today's webinar. We are so thrilled to have all of you with us today. We have 4 incredible panelists, and they have a wealth of expertise to share with you during this next hour. Each of our webinar participants will start with a 2-minute introduction about themselves, their current role, and their key guidance and advice about how to start a career in global health. And then we will dedicate the remaining time to your questions and answers. We received stellar questions already from you, our webinar audience, by Tuesday's question submission deadline, and those are in our queue today. We selected the most common and most thoughtful questions to ask our panelists. We also invite you to submit additional questions in the text box on the left of your webinar screen, and we'll select those questions to ask the panelists today as well. We also encourage you to tweet about the webinar, including your key lessons learned, by using the hashtag GHUwebinar, and you can see the hashtag in the webinar visuals on your screen. We will now proceed with having each of our panelists introduce themselves. I'm delighted to introduce you to our first panelist, Nitya Kanuri. Nitya, if you can please introduce yourself, share your background and current role, and share your key guidance regarding path to a fulfilling career in global health.
Yeah, wonderful. Thank you so much for the introduction, Jennifer, and the invitation to be here. I'm definitely really passionate about this topic and hope I can provide any insights I've learned on my own path. So my current role is Open Data Manager at Crisis Text Line. So Crisis Text Line is a tech nonprofit that provides 24/7 crisis support via text. So there's about 2,000 volunteers around the U.S. who support about 1,200 to 1,400 requests from people in crisis in the U.S. each day. And as their open data manager, I manage basically how we share all this data that we gather with both the public and research partners and media to first reduce stigma about crisis and mental health, enable better research and more collaboration to improve the service as well as improve the crisis intervention space as a whole. My previous experience was working as a research project manager at Stanford School of Medicine for the last 3 years and working at the VA and the National Center for PTSD, doing research on mobile apps for veterans. And I think working in those environments, I learned a lot about where I want to be in the global mental health space. And I think I really learned I love implementation. So I think as researchers, we often spend a lot of time thinking about developing the best intervention, the most evidence-based findings. And I really like thinking about, okay, wonderful. So we have this thing. We know it's a value. Now, how do we customize the delivery for the communities that we designed it for? And so I'm really excited about my transition to Crisis Text Line, in which I get to help interface with both the researchers who are curious to use our data to drive important insights, but also connect those insights back to how we can improve our service. I additionally spent about 50% of those last couple of years working in India, focused on delivering online programs for mental health to university students in 4 universities across India and Dubai. And again, that was just, I think that experience really helped drive home this point about a curiosity to focus on implementation rather than development of the intervention. So I think that leads me to my, I guess my greatest advice or lesson learned in my short process over the last couple of years was have faith that the dots always connect. I'm pretty sure that's from Steve Jobs, but I think for me, I learned that exploring options, moving from a research role to a project manager role and now to a data scientist role, all of them have allowed me to find my fit. And I think my learning was don't feel guilty about exploring and stress testing and finding your fit now so that later on you don't feel like you're still wishing for something else. Quick story, in college my essay was about the magic 8-ball named Simon that I carried around in my purse. This is my entry to Penn, and I wrote about how the fork in the road for me looked like a tangled mess of spaghetti. So I would say my process over the last couple of years has been more about pruning, and my advice is don't feel guilty about exploring and doing that pruning.
Excellent. Thank you so much. And Natacha, Poggio, can you please also introduce yourself, share your current role, and share your key guidance related to a fulfilling career in global health?
Hi, everyone. So, yes, I am a social impact design educator. I teach graphic design at the Department of Art at Lamar University that's located in Texas. I am also the director and founder of Design Global Change, which is a design-based collaborative where students and emerging professionals in design work together with health and environmental nonprofit organizations. And the idea is to strive to make a positive difference in the world based on the communities they serve. We have developed wellness projects in several parts of South Asia, in Africa, in Kenya and Ghana, and also lately in South America. Some of the most outstanding projects that I had the opportunity to coordinate were related to gender equality project in India And then another one that was prosthetic training across borders, which was a collaboration with University of Hartford, the previous institution I taught, with the physical therapy department, developing visual materials that could effectively educate patients that have lost their limbs and learn the rehabilitation protocols to regain mobility. The focus of my research is basically socially responsible design, and my concentration is on global health and social impact. So the projects relate to providing sustainable opportunities for the communities we work with to develop their own tools for global health. In this case, we come and help a nonprofit organization with their graphic design or visual communication needs. So my approach from the design background is a little bit different from the other speakers. I would say that in terms of career perspectives, I encourage my students and anyone else that I meet to consider the opportunity of working across disciplines. So with my graphic design students, visual communication students, the idea of meeting nurses and doctors and public policy people who need to communicate messages, and sometimes language is a barrier. So graphics, information graphics, and also images and illustrations are very beneficial for people who have like limitations with language barriers. And I think that for people who are working in global health that are not familiar with graphic design or working with the arts, it's a good opportunity to reach out to schools like programs like mine who have the talent, and the students are working on gaining more skills to create projects, develop projects of partnerships where they will come with a particular need, communication. For example, latest project was on Zika prevention, and then develop that as a tool that could be used for the organization.
Terrific. Thank you so much, Natacha. And Carter Powers, please introduce yourself as well and share your key guidance.
Hi, this is Carter Powers. I'm the Chief Operations Officer at Dimagi. Dimagi is a technology company. We're a social enterprise, and we're a benefit corporation, which is a new type of corporation that's sort of a hybrid between a nonprofit and a for-profit model. So we're a socially focused technology company that mostly works in global health. So our technology works to deliver quality healthcare both in urban areas as well as rural communities across the world. Most of our technology focuses on frontline health workers, which are typically community healthcare workers who are using mobile applications and SMS tools to both deliver services related to child health, maternal child health, and various non-communicable diseases, to also gather data, and we really work internationally. So our technology is being used in 50 countries across the world. We are primarily based in Boston, Massachusetts. We have offices in West Africa and Dakar, Senegal, in South Africa and Cape Town, as well as in Delhi in India. So we're a very global company, and we work with a lot of different international NGOs, and we've grown tremendously over the last 5 to 10 years. Just in the last 6 years, I think we've grown from 10 people to today about 117 people. So we've had a lot of growth, a lot of career opportunities for a lot of people. And if you look at our team, we're a very broad mixture of engineers, public health experts, and former consultants or business people. So my role across Dimagi is I largely manage the business side, as well as HR or our people operations. So I'm involved in the strategy all the way down to some of the nitty-gritty. So I look forward to speaking with everyone and hearing your questions. My greatest advice or lesson learned thinking about a career in global health is to not only think about the mission of the organization and the impact that the organization can have, but really also to be mindful about what role you will find the greatest happiness within any organization. So I often will be talking to people during recruiting efforts and really trying to press them on, are you the type of person that likes to be in the field, seeing the impact of our technology, working with the end user, or are you going to be okay working on the operations side, where you might not be able to see that direct impact, but you might be amplifying your own impact? So I really have found a lot of value jumping from different roles over my career, really trying to think not just about what the organization is doing, but whether you can truly find the right fit and make yourself the happiest in the role that you find.
Wonderful. Thank you so much, Carter. And our final panelist, Lisa Russell, please also introduce yourself and share your key guidance.
Okay. Well, thank you very much, Jennifer, for having me, and looking forward to the webinar. So my name is Lisa Russell. I work as an independent filmmaker, but I did not go to film school. I ended up getting my master's in public health and international health in the late 90s, and I landed my first job in Kosovo and Albania during the 1999 war. And it was there that I sort of experienced and was witness to the exploitative nature of the media and how they were trying to tell the story about rape as a tool of war, which we all know is an important story, but the manner in which the journalists were speaking that story was offensive and exploitative, and it made me want to become a storyteller. And I wanted to become a storyteller because I wanted to tell global health and development stories differently. And that's basically been my kind of driving force throughout the rest of my career. I now work as an independent filmmaker. I'm a director. I produce, I shoot, and I edit my own films. And I've worked with a lot of different UN NGO agencies covering a wide range of topics. Some of my films include Love, Labor, Loss on obstetric fistula in Niger. I did a film called Not Yet Rain about unsafe abortions in Ethiopia. I did a film on the impact of war on young people called Youth Zones, and right now I'm circulating a film called Mother's Cry about climate change. So I'm really sort of I'm sort of an activist filmmaker where I use film as a tool to do global health advocacy. I do a lot of other things, and I'll kind of talk about that a little bit later, but that's kind of really the focus of my career. And I think for me, the greatest advice that I would give people entering the global health development world is just trust your journey. I switched my careers at least 3 or 4 times. I had a lot of angst. I was not the person that knew what I was going to do from the age of 10. I had to really have experiences, some which were great, some which gave me the insight to know that it's not what I wanted to do. I started off as I was a hip-hop dancer and a pre-med student who wanted to be an ER doctor. Then I ended up as a humanitarian aid worker. Then I ended up as a filmmaker. And now I'm sort of entering the tech world with a new project. So I would just say to all of you who are still trying to figure it out, just keep going, take experiences for what they were, and just trust that you're gonna find your destination, even though you may not see it right away.
Terrific. Thank you so much, Lisa, and thank you to all of our panelists. As you heard, they have a great wealth of expertise and guidance to share with you today. We will now proceed with the question and answer session. As mentioned, we've received many excellent questions in advance from you, our audience members. If you have additional questions, please post them in the text box on the left of your webinar screen throughout the webinar. Our first question is for all of our panelists. William Fahey recently said in a commencement address to develop a philosophy instead of a life plan. What would you say your life philosophy is, and how has this played a role in your work? And perhaps we can start with Lisa Russell, and we'll go backwards in the order that we just did the introduction.
Great. Okay, so I guess it's kind of a personal, professional question because I've had a lot of people question my journey. A lot of people, when I said I was going to be this filmmaker and I was working for the UN, and at the time there was no career path doing this. I sort of was making things up as I went along. I had my brother question, like, what am I doing with my life? I don't have a house. I'm not married. I don't have this and all of that. So I think for me, like, my life philosophy is that first of all, I really do believe you need to be happy. You need to follow your passion. I know some people say that's risky. You might be sacrificing a lot, but I, for one, cannot imagine having a job that I'm working 60, 80, 40 hours a week, not loving what I do, and I really love what I do. And I also think that for me, like, no is really not an option. Like I had to overcome a lot of obstacles to be able to be the filmmaker that I am. I had to learn how to edit, and it was mostly because I didn't have the resources to just make everything happen. So I had to learn a lot. And so for me, I just kept at it. I wasn't sure exactly what was going to end up, but I knew that I wanted to be the storyteller. I knew that I was telling stories differently. And so I really think that my life philosophy for myself and for my work is that if you have a dream and you have a passion and you pursue it, you just don't take no, and don't let anybody else tell you what you should or shouldn't be doing.
Terrific. Thank you, Lisa. And Carter Powers, do you have additional thoughts on your life philosophy and how this has played a role in your work?
Great. Yeah, I love the question, and I think there's different schools of thought, so I will give my 2 cents. But I, for one, am someone that doesn't really have a different work personality from my personal personality. So a lot of my life philosophy is important for me, that I am sort of the same person in and out of work. And a lot of our philosophy at Dimagi, we sort of rally around our 3 sort of core tenets, which is impact, the team, and profit. And we always have to add in that order as a social enterprise. So in my life philosophy, I'm also trying to seek that I have a good impact on the areas that I touch in the world. I like having a good time and interacting with people, and I get a lot of value out of interacting with the team. And then naturally, I need a certain standard of living to sort of pay the bills and maintain a reasonable lifestyle. So fortunately at Dimagi, what I typically find is that the people that mesh the best with the company also sort of have a similar life philosophy around those same principles. So I'm happy to say that I think my personal life philosophy matches very nicely with the company that we've been able to create and continue to evolve over time.
Great. Thank you so much, Carter. Could you please share your thoughts as well?
Sure. Yeah, I was almost about to start while we were waiting for you. Well, Lisa said something that for me was striking a chord in her previous answer about trusting your journey and keep going. And I also believe that everything is a step-by-step process of discovery, and we learn as we go. And sometimes we make mistakes, and we have to accept there's failure along the way. But those are like ways to learn. And I totally agree with her, follow your passion, because yes, this is like a very rewarding profession, working with global health, once you are like passionate about it. If you are like forcing yourself into a career that you're not going to enjoy, regardless of what the career is, it's going to ultimately not make you happy. In particular, for my life philosophy, it's very deeply embedded with my approach to design and development, and is related to putting yourself in someone else's shoes. As designers, we have to do that. We have to work with clients or community members, and we need to understand what their needs are. So therefore, I cannot bring my own assumptions for a solution that I need to conceive unless I learn how their needs are not met or are not satisfied, and then understanding from their perspective, from their worldview, which requires a lot of research and a lot of deeply embedding yourself with communities. I think it's a mind-shifting approach when you see things from a different perspective. And sometimes you come to a project, and then when you start like learning like the constraints that they have in the community, be it, for example, in a project that relates to working with gender equality, and we ran into issues where in the school the boys and the girls were not sharing the space in this rural village in India. So therefore there were no conversations that will allow to understand the difference between both genders and how to appreciate and recognize the value that each brings to the community. So we will be assuming that because we work in the U.S. and with my team, things are like as equal as we are related to in everyday life. But once you go and deeply embed yourself in the community or in whatever situation you are working, and you put yourself in their shoes, it brings this knowledge that it can only get by kind of like shifting perspectives. So that's my life philosophy.
Fantastic. Thank you, Natacha. And Nitya, if you can also please share your thoughts on your life philosophy and how it plays a role in your work.
Yeah, absolutely. I mean, I think all the three lovely speakers before me kind of covered a lot of the same principles that resonate with me. I definitely take my work to bed with me, and I like that. And so knowing I'm that kind of person, I've always been very mission-driven in how I spend my time. But I guess one thing to a different nuance to perhaps the same concept, I think something I've learned is always ask questions and ask for help. There's always someone who probably knows what it is that you want to know. So find them, reach out to them, show them you like thinking about what they like thinking about, and build a relationship. I think I've just learned to not be afraid of feeling awkward or pushy or let insecurity prevent you from going after the things you want to go after. I guess a personal story would be this job that I recently started 2 months ago. I emailed the CEO, cold emailed her, said I told her I thought she was a badass for starting what she started and growing something I felt resonated with my belief system, and it's a mission I want to work on. So I think my life philosophy is always ask questions, reach out, and build partnerships and relationships.
Fantastic. Thank you so much, and thank you to all of our speakers for all of your insight. A question for Lisa. What are some common misconceptions about a career in global health or about the field in general?
So I'll answer this from a filmmaker perspective. I think that I've been approached by a lot of folks who were in the same dilemma that I was, which sort of like, can I continue to pursue my creative interests? Can I continue to be an artist? Or do I have to give that up to be a global health specialist? And what I think I would like to share is that you can do both. There may not be NPH departments or, degree specialists that combine the two. I know there are some where you can get a dual degree and, an NPH and a journalism degree. But if you're a writer, you're a poet, you're a musician, there is space for you. You may have to pursue sort of two lanes of a career, one as an artist to develop your craft, and then one as a global health specialist. But I definitely think not only is there opportunity, but I think that there's necessity of incorporating creatives and artists in global health advocacy at least.
Terrific. Thank you, Lisa. And a question for Carter. Looking back, is there anything that you would change about your early career decisions?
Great question. Hindsight's always 20/20, but I actually can't say that I would. So just to give you a quick background, so my education and background in university is actually in computer science and electrical engineering. I then went into the corporate world and focused in financial services, banking, and management consulting, and then decided I was not interested in those long term. I wasn't getting enough happiness out of them. I transitioned to a nonprofit for a few years and then got a little bit caught up in some of the challenges of funding with nonprofits, and it was a very research-heavy focus, which wasn't really gelling with my personality. And then finally, I found Dimagi, which really sort of matched a lot of my life philosophy. So I've had quite an evolution and jumped around as many of the other speakers have. But each experience really builds new skills, and new experiences really prepare you for a lot of new areas. So I think without a lot of the mistakes and challenges that I had uncovered, I would not have been able to solve a lot of the problems that we're solving today at Dimagi. So I wouldn't change anything, and I would recommend, sometimes people feel paralyzed when they're trying to make decisions, and I would take some of the examples of the other panelists and myself as it's okay to make mistakes, and I would almost encourage you to make a decision, take a leap, and learn from it rather than thinking you're necessarily going to jump to the right fit for you quickly. often it's better to take a leap than not to leap at all.
Fantastic. Thank you, Carter. And another question for you, Carter. Newly minted master's and graduate students who wish to start a career in global context often experience a catch-22. They apply for their first experience in a low-income or middle-income country, but often the starter jobs request the new graduates have already had experience in low and middle-income countries. What is your solution to this problem, and how would this principle apply generally to the development field and the field?
So at Dimagi, we don't typically require a public health background for most of our roles. We do about 80% of our work in healthcare, but we also work in other sectors. So at Dimagi, it shouldn't really be a big barrier. More generally, when you look at other institutions in global health, and if you're just coming out of university, what I would typically recommend is to hit this question very transparently in your cover letter. When you're reaching out, be transparent about a concern that you think might prevent you from getting an interview, and actually be very upfront about it and talk about why you think you can overcome that. So whether you've had experience in other areas, whether you're a quick learner. So the biggest mistake that I see is that people will sort of be nervous about realizing they don't have some sort of experience. And the best way that I recommend overcoming that is to be really transparent, because the right organization is looking for smart people that can learn things quickly and get things done. And if you're able to attack that question head on, you will sort of remove the doubt that people might have because you're being really upfront and very transparent about why you think you can overcome that challenge.
I would like to add something.
Yes, please do, Natacha.
Yeah, so my students are not necessarily experts in global health, but what they work is they create design graphics. And one of the things is some of them are very passionate about communicating messages that have like largest importance, like related to sanitation, related to education. And what I tell them is exactly the thing that Carter said, is highlight those things in their cover letter, because you're not going to put in your resume that you are working in global health, but you will like in your cover letter to contribute to an organization that is working with global health. And you can contribute your design skills, your editorial, your graphics, your illustrations. And I think that is very important for people who might not see a specific fit related to global health to think how their skill set maybe it has to do with copywriting, maybe it has to do with networking, maybe it has to do with using social media. There are multiple ways that you can approach a job, a career in global health that doesn't relate necessarily to go into public policy degree or like medical school, et cetera, et cetera.
Excellent. Thank you, Natacha, so much for adding additional insights. Terrific. And Lisa, a question for you. The MPH has been the standard bearer for global health work. Do you think this will be changing? And are there other more attractive options for adding value to a sector already saturated with MPH holders?
I think this is a really good question. And I think in general, our whole work culture is going to be changing in the next few decades. I do think that there's value in a global health MPH degree. I do suggest that if you are seeking that program, to try to find a program where students who are in your program come from other countries as well, so that in the classroom you're hearing from, for example, ministers of health from different countries, and it's not just sort of a bunch of Americans talking about global health. I also would just say, just in general, that what I've noticed now as a professional in my career is that different sectors have different, what I like to call different codes. They speak different languages. They have a different culture. And I do think that you can tap into that code, but either through a professional degree or through networking and studying and researching and getting to know people in the field. The language that I speak and the culture of the United Nations is vastly different than the language I speak and the culture of socially conscious artists. But interestingly enough, I feel they're having parallel conversations because they both want to improve communities and save lives. They just do it very differently. So when I walk into the UN, the fact that I know their code and I know their language, people size you up very quickly. If you know the acronyms, if you know who's who, who's what, who's whatever, it does build a certain sort of credibility that somebody who's not experienced in the field wouldn't know these things. So I will say yes to both. The workforce is changing, and MPH is absolutely valuable for global health work. Can you get around not getting it? I believe so, but you also need to put in the work to understand the sector that you're trying to infiltrate.
Terrific. Thank you so much, Lisa. And Natacha, the wide range of potential careers in global health can be overwhelming at times, especially since there's no longer one traditional route. What advice do you give to individuals trying to figure out how to translate their interests and skill sets into a global health career?
That's advice so much that we could talk about. Like I said earlier, I think collaborating with people from different disciplines is super important because they bring different perspectives other than your own. I also remember that Nitya said that don't be afraid to ask questions. I think that's very important, especially if you can identify a mentor who can advise on pathways you can possibly pursue. And that could be a mentor that is from your school where you studied, or it could be someone in an organization, perhaps volunteering or intern at an organization that inspires you because of the work that they are doing. And not necessarily you will have all the set of skills to start a job that you are learning, and you could perhaps volunteer for Unite for Sight. And then I think that it's important to be open to criticism and feedback, because sometimes, again, putting yourself in someone else's shoes, you come with certain sets of you come to work with organizations with a certain mindset, and then you need to understand that careers in global health or global health work isn't easy. It takes a lot of time. It takes a lot of different stakeholders that participate, from policy makers to the clinicians to someone that is in the field working and collecting data. So it's about being very open and receiving feedback, and with that, don't be afraid to try step by step to embrace failure. And I think that the idea of failure is something that is discussed. There's TEDx talks and there's a lot of stuff going on about failure, but it's something very important, because sometimes the path is not a straight line. In fact, actually, most times it's not a straight line. And by making some mistakes along the way, you actually are forming yourself as an individual who has a versatile backpack that you could take tools out of it and then solve different problems. And I think that's very important for any discipline that is interested in working in global health.
Excellent. Thank you, Natacha. And Nitya, what do you suggest for making skills and experience working on domestic health improvement more relevant to global health positions and vice versa?
Yeah, for sure. I think in my experience globally, particularly working in India the last 2 years, and also domestically, communication has been perhaps the best predictor of collaboration and project success. So in the vein of making work experience locally more relevant domestically, I think emphasizing skills like project management or the ability to work across teams, manage up and manage down, are all things you learn and practice domestically and in most projects, but I think become particularly salient and important when working globally. I know one piece that I learned was scheduling Skype calls with, 8 important individuals in 5 cities across the world, and managing to keep it at 1 hour and get all ideas expressed was something I didn't plan for being such an important part of ensuring project success, but I think emphasizing that you can bring different people with different perspectives together is something that becomes really important when working globally.
Wonderful. Thank you. And Lisa, in hindsight, what were the turning points early on in your career that have gotten you to where you are now?
I'm sorry, one more time? What are the
In hindsight, what were the turning points early on in your career that have gotten you to where you are now?
Well, I think for me, I was loving what I was doing. I loved the projects I was on. I loved traveling. I loved making films, sharing the films, sparking really important conversations. But I think I really struggled ethically with becoming a filmmaker that tells global health stories because, as my African friends would say in Tanzania, for example, like, we love when you come here, but why is it when you make a film about Tanzania, you show the bad parts about it? And that really hit me because I didn't want to be the exploitative storyteller that made me want to be a storyteller in the first place. But I said, I work for the United Nations and I work for NGOs, so how can I tell a film about obstetric fistula without showing the suffering that women would go through? And I really struggled, and I got asked to speak at the first Social Good Summit, and they were wanting me to sit on a panel called The Power of Film. And then I started to ask really hard questions, like, if film is so powerful, which it is, like, who has the right to be telling these stories? Are Americans telling African stories the right approach? Or, the fact that we can influence funding and policy decisions means we can justify the work that we do? And I really did struggle with it to a point that I almost stopped becoming a filmmaker. But I think with time and really, thinking through and doing a lot of self-reflection is that I think the problem that I had with global health storytelling is it was so much focused on, like, charity and pity and, it's like a weird power imbalance that, we need to come in and have this savior complex and save people. And I really, the socially conscious artists that I work with reframe some of these issues to more like social justice issues. So, if there's a health problem, it's not because the person is poor and incapable and, they need help. It's that there's something wrong with the system, or there's something wrong with the society, or it's like the problem is different. And when I started being able to look at global health issues differently, and when I started to engage socially conscious artists in the work that I do with the United Nations, I just felt that it became a much more respectful and responsible way to tell stories. So I think that that's true just in general for anybody working in this field, because we all are storytellers, whether we're doing it on a stage or we're doing it with family and friends. But to be able to understand your sort of sense of privilege in the world and the kind of work that you're doing is critical. And I would like to see more conversations about this happening. I would love to see a full conference happening. I do workshops around this, but I just think in general it's an important topic that wasn't discussed in my master's program, but which I sort of learned during my evolution as a filmmaker.
Thank you, Lisa. Such excellent insight, and actually brings us to another question for you. Global health has become very popular and even trendy in recent years, particularly through volunteerism, social media campaigns, celebrity endorsements. This fad raises concerns and can lead to unethical and culturally incompetent service work and portrayals of cultures and communities. While these programs may have started with good intentions, they often fail. How have you shaped a career that raises awareness about global health issues with media in a respectful way, and what are some of the most important lessons you've learned along the way?
Well, I think for me, there were a couple of key moments in my career that really kind of just sparked something in my head. One was that when I was doing the film about obstetric fistula, I actually turned the camera around and let the women with fistula interview me. And one of the things that they asked me, they said, we have a question for you. You're American. You come from a rich country. Why is it that American women, when they have so much money, why do they choose to only have 2 children? And I was like, well, that's interesting, because we keep asking why poor women keep having too many children. And it was just an interesting conversation, and it's not one that I feel happens a lot. Like, especially for storytellers, I think in order to be an effective storyteller, you need to be able to sit in front of the camera and speak and tell your story. And that was one lesson. And then another one was when I was in Malawi shooting a man who was dying of AIDS. And when I was done with the 2-hour interview, he just kept thanking me because I was the only American he had ever seen in his village. And he was dying. He was sick, and he couldn't take care of his grandkids. And he was the most beautiful man and just kept thanking me. And I was getting annoyed with him thanking me because I'm like, stop thanking me. No, thank you for sharing your story. And he just kept going on and on. It just made me realize, like, wow, for me, my camera equipment alone could fund his medication and his treatment, and he's thanking me. And then the policies in my country are weak. Like we could invest more money in ensuring people living with HIV have the medications that they need. So it was sort of like, for me, it was a lesson in power dynamics, and there's a huge power imbalance between humanitarian storytellers and filmmakers and journalists and the people that we're telling stories for. And I think, I'm doing this workshop in Tanzania. I'm happy to share the link for anybody who's interested, but we're going to be working with the Maasai, and it's not that we're just going to make films about the Maasai, but the Maasai are going to make films about us. And I think by addressing that power imbalance or that, sense of privilege of Americans or Westerners working in global development, I think we'd all be more effective in what we do and to treat the people that we're working with, either through our stories or our work, with more dignity and respect than I feel we have been.
Excellent. Thank you so much, Lisa. And a question for Carter. Missteps, mistakes, and failures can become valuable learning experiences. What insight would you give to someone who wants a career in global health but is struggling either in finding their place or in finding a job?
Be persistent. I think it's important to really keep trying and not get discouraged. I think talking to current organizations, while it's often hard to get interviews, you can almost always find an in where someone is presenting their work in a public forum like the Unite for Sight webinars or other places, and you typically do have access to a lot of these people without quite realizing it. So the more conversations that you can have in a non-interview context, the more learning you'll have and better prepared you'll have to know how to get your foot in the door in a lot of different organizations. So I think if people are persistent, almost to the point of being annoying, I always find time for them. So I think being persistent is probably the most important thing that we can do to make progress in this area.
Great. Thank you, Carter. And a question now for both Lisa and Carter. Perhaps, Lisa, you could begin. It's not uncommon to hear that global health professionals originally wanted to have a much different global health career. What influenced your change in career focus, and what advice would you give to someone who's going through a drastic shift in career goals?
Well, I think it goes back to the thing I said at the beginning, which is to sort of trust your journey, because all along the different kind of career paths I was choosing, I felt it wasn't quite right. And I took those experiences and I applied them in a different area, and then that wasn't quite right. But when you find the thing that is the right thing, like it's such a, well, it's a relief, but it's just for me, it just made sense. Like I found what I'm supposed to be doing, and it may have taken me a very long time to do it. But I felt that being persistent and having as much exposure to all different things that would supplement my personal interests, my career interests, what I'm passionate about, all kind of came together. So the advice I would give is just surround yourself with as many different experiences, especially if you're early on in your career. Maybe either take a class or get involved with an organization that you don't know much about, or a field that seems so far off, and you may learn something that may spark your interest. And even if you decide not to go down that route, like I worked at a socially conscious PR agency, and learning how to write press releases helped me in the work that I do as an advocate and as a filmmaker. So you can pick up different skill sets, and I think going into the future, people who are able to multitask and do a lot of different things will help you with whatever one path you're choosing.
Great. Thank you, Lisa. And Carter, do you have additional insight on changes in career focus?
Yeah, it's really important to keep your confidence. So when you're entering a new industry or a new sector or any new environment, it's really easy to feel like everyone else knows what's going on and you're the only person that doesn't know. So I always really encourage people to have a lot of confidence and be really transparent with what they know and what they don't know. That if you're a smart person that can get things done and you're aware of when you have the knowledge to make a decision or when you don't, you will build confidence in people around you, whether you're new to the sector or new to the industry yourself. So being able to articulate what you know and what you don't know and having confidence that you're on the right line of that division is really powerful as you make transitions to new areas, because everyone can learn more things as they get more experiences. And if you show really good judgment around being transparent about what you know and don't know, it can really go a long way to start building that confidence in a new area.
Great. Thank you so much, Carter. And a question for Nitya. What has been the most surprising or unexpected part of your global health work?
Let me see I guess the most surprising part in learning for me in the context of working on a research collaboration between partners from Stanford and partners in India was that people are people. So I think we often emphasize the differences when we think globally, but I guess it was I was surprised by the sameness. So I think we all come to the table with different beliefs, different research methodologies and different approaches. But I think in my experience, there's always something that can bind two people or two groups together, whether one is from the U.S. or one is from India or one is from X country or Y country. In research in particular, I think we often pride ourselves on uniqueness and novelty of thinking and design. But my big learning was there's an underlying sameness. You know, I think people in the U.S. and people in India are thinking about the same problems of mental health care resource allocation, but there's some adaptation for cultural relevancy. And I think this framework of trusting that, maybe trusting you're not unique, promotes true collaboration. Something that our team tried to do a lot of was a method called CBPR, or community-based participatory research. And its approach to involve the user, the patient, whoever it might be, at the first stage of development, ask questions together, define the problem, and then involve them in the evaluation of data. I think their knowledge of what's happening on the ground will be so invaluable when you think about, okay, what's the story behind these numbers? And lastly, implementation of findings. No one's going to know, even if you're an expert in a certain field, no one's going to know the best route to deliver it more than the person who lives there and the very community you plan you're designing for. So to summarize, I think my learning was that there's a lot of commonality, whether there might be thousands of miles in between.
Great, thank you. And another question for you. What is one of the most frustrating aspects of working in global health, and how do you deal with these frustrations or barriers?
Okay. Well, I think this might be in contrast to what I just shared about the underlying sameness, but I think working across borders and particularly across cultures adds a very specific lens on certain issues. So I'll share probably my most frustrating experience in working to make mental health care more available using online programs in universities in India. So I remember I had one meeting in which we were sharing some of the midterm data back with our stakeholders, specifically the dean of students at one of our university campuses, and he had asked if I had any survey data on sexuality. And I told him, yeah, we do collect that under demographics, as we do in all of our surveys across different universities. And he said, oh, good, I wanted to just know how big, the issue is so that we can put remediation measures in place. And I nearly exploded. I definitely could not hide the shock and judgment on my face, and was just without words. But I think the learning was, or at least how I handle those frustrations versus imploding and terminating a relationship was, I had to step back and realize that, this person has been at this university for 30 plus years. He truly, truly cares about students. And in his view of the world, in India in particular, being LGBTQ or something not traditional might lead you into more hurdles or challenges in his view. And so we wanted to help prevent students from experiencing the challenges he believed would occur given his frame of the world in the last, 60 years. So I think my my lesson on how to deal with frustrations is just to learn to step back, check my judgment at the door, but of course don't compromise on my beliefs, and try and find that commonality behind aligned intentions, even if communication is not always aligned.
Wonderful. Thank you. And Natacha, what is the most fulfilling part of your work, and is it what you expected when you first started?
I think that for me, it's seeing how people learn from the work that I have been involved in creating. Perhaps it's because being an educator, I see the reward from my students learning something new and then applying it. And when they realize, oh, this is what you get when you use this type of tool or this type of software, or like perhaps a methodology. And applying that to when I started, I think at that time I wanted to solve problems for my clients as a designer. And then now with the global health work that I'm doing, what I want is to positively enhance people's lives. So it changes from like solving a particular problem to basically making someone have a better experience with their surroundings and whatever is the thing that relates to the global health issue, be it wellness, be education and gender equality, be like something related to farming and nutrition. I think that if I can contribute just a little bit with my design knowledge and making their lives and experiences, their daily experiences better, I think that that's the most fulfilling part.
Fantastic. Thank you, Natacha. And Lisa, mentors are influence in the quest for a fulfilling career path. How have your mentors affected your work, and what do you think are the most important qualities to look for in a mentor?
So my big mentor for my global health work was Jonathan Mann, who is the pioneer of the global AIDS movement and founded the Health and Human Rights Center at Harvard. And I think for me, it wasn't that he gave me a bunch of new information. It's that he inspired me and he made me think about things very differently. Like, it was the first time I heard health being talked about as a human rights issue, and that's basically what made me decide I didn't want to be an ER doctor. I didn't want to go into medicine, was because all of the social activist type work I did was being talked about in the way that he spoke about the global AIDS epidemic and whatnot. And so he also broke a lot of Harvard rules for me to go to his class, because I wasn't enrolled at Harvard at the time and I wanted to take his class, and he basically, I think, felt education was more important than policy. So he let me sit in on his class when Harvard was telling me that I couldn't. So I think qualities that are good in a mentor: I mentor young people. I take my role as a mentor and a teaching artist very seriously, and there are times where I am not open to mentoring because I don't have the time and dedication that I feel like it takes, or the accessibility to really invest in somebody. So one, I would say if you're going to choose a mentor, make sure they're accessible to you in the way that you need them to be. I would also say that sometimes you can get mentorship through workshops or, other ways that you get access to people who can influence you. But I think over time what I've realized is that the people who inspire me, who have had the biggest influence in my career, are not people who gave me any advice or anything. They just inspired me. Like, I just looked at their career path. I looked at what they did in the world, and I was just inspired, and it made me want to learn more about how they did it and what they did. So.
Great. Thank you, Lisa. And actually, another question for you. What is one thing that you would advise someone pursuing a career in global health to not do?
I would say, I think I would say that don't let people tell you no. I know some people may have parents who don't want you to pursue a certain career path, or are concerned about working in war zones or doing whatever. But I think ultimately you know what you want in your life, and so I would just, if you're committed to what you're doing, just keep pushing on. You'll have a lot of maybe non-believers or people not confused about why you want to do what you do. But when you're passionate and you really are committed to what you want to do, you don't want to sacrifice that for somebody else's happiness.
Great. Thank you so much, Lisa. And thank you to all of our phenomenal panelists. This brings us to the conclusion of the webinar. Thank you so much again for all of the insights that everyone has shared.
Thank you.
Thank you, Jennifer.
Thanks, Jennifer. Thank you so much, Jennifer. Thank you, everyone.
Thank you so much.